So what I really wanted to talk to you about today was how we can provide value to your patients currently. I know that the doctor sees a lot of stroke patients here and other people with other neurological conditions. I wanted to specifically focus on stroke. Are you seeing a lot of stroke patients in this clinic?
We see a ton. We see some Parkinson's, but honestly, I would say stroke is one of our top diagnoses in the clinic here.
One of the things that Inhabit's really honing in on right now is our low vision program. Here's a little flyer just with some more information, but basically we want to look at these specific diagnoses and see how those diagnoses are really impacting our patients' safety, you know, from a different angle.
I can think of some of our patients that actually have experienced sight loss because of their stroke. And so that is a factor in our clinic, those patients that just don't see as well.
Yes, absolutely. So, you know, people who've had a stroke, they usually have hemianopsia or just visual cuts, visual deficits, blurry vision even. And what our field clinicians are really seeing is that it's impacting their safety within the home, and it's leading to an increase in falls as well. So those patients who have experienced a stroke are really at a risk for higher falls. And we at Inhabit, we do have a fall prevention program specifically geared towards, you know, improving patient safety within the home. So one of the things that we do, that our clinicians do, the therapists, they conduct a home safety evaluation, and that just allows them to be able to assess any safety hazards within the home, whether that be loose cords, poor lighting, clutter, and things like that, and they can make recommendations to the patients in order to improve their safety. Because, you know, a lot of the times, especially with our older population, you know, there are hazards, walking hazards, and especially if they have to use already a walker or a cane, that's going to add even more hazards to the environment. So we really want to get in there and provide that service for them. This is just an example. This is one of our fall prevention booklets that we give to our patients. Depending on their diagnoses, we can have ones that are more applicable to them. But one of the other things that I wanted to hone in on is that, you know, when there are safety hazards, and especially with people who've had a stroke, they might have some type of neuropathy going on as well. And so this really enables us to educate the patients on how to, you know, prevent any injuries within the home. And so I just really wanted to talk on those and speak on that, to see if, you know, that's something that kind of you guys would be interested in looking into, or seeing if you had any patients that have those diagnoses that, you know, we could provide those services to.
We definitely have stroke patients that I do think would benefit from a home safety eval. We had Mrs. Jones last week that, you know, fell over the weekend and was sent to the ER. Luckily, she didn't break anything, but I do think that because she just doesn't see as well, she's 97 years old, you know, that this could be a benefit for those types of patients.
Absolutely. And, you know, a lot of the time when we're dealing with stroke, the doctors and the therapists, they're really focusing on those gross motor activities and skills. And so sometimes low vision or visual impairment can be sort of overlooked or put on the back burner. And so we really want to put this to the forefront and focus on that so that we can enhance their safety in the home.
Okay.
Yeah. So is there anybody that you're thinking about, Miss Jones specifically, that maybe we can take a look at and see if she's appropriate for Inhabit home health?
Yes, I can get you the referral. What would you need? I haven't really sent a referral for home health before.
So we would just need a face sheet, so their demographic information, the specific home health orders, so if they're needing nursing, PT, OT, and then also just a face-to-face clinical note. And then from there I can facilitate that referral. The next step would then for me to make contact and all of that. But
So for this particular low vision, would that be physical therapy and occupational therapy? Would it be nursing? What skills would I check on that?
Sure. So if they have any nursing needs, any applicable nursing needs, we can definitely do that. But the physical therapist and occupational therapist are both trained to conduct those evaluations. So that would be sort of the primary clinicians that we'd focus on.
Okay.
So if you would, you know, if her nursing services or her medication management if she's stable medically, we can just do therapy. But if you also want us to monitor her medications, you know, or anything else, medically speaking, we can.
Okay, great. Well, let me go pull her stuff for Mrs. Jones and I'll get that to you.
Wonderful. Thank you so much.
Thanks, Laura.
Thank you.
Great job.
Cool.